Avulsion, according to LS and DV's classification, it is class 5. It is X-articulation, and according to the WHO code, the code is N503.22. And avulsion being the most severe form of traumatic dental injury, we're lucky that it constitutes only 0.5 to 3% of all traumatic injuries to the permanent teeth. And it is the most common tooth which is avulsed is maxillary central incisor, and it is seen at the age of 7 to 9 years. And why it is so common at this particular age is because the periodontal ligament is immature at this age. The root is not completely formed, and also the surrounding alveolar bone is not completely mineralized. So it is pliable. So any trauma or any force to the tooth does not cause a roof fracture, does not cause the enamel or dentine fracture, and generally it might lead to, that force might lead to the tooth coming out of the socket. So that is why it is very common in the age of 7 to 9 years. So what are the structures which are damaged when a tooth is avulsed? The two important structures which are damaged is first is the periodontal ligament. It is completely torn. The periodontal ligament is a structure which is attaching the tooth, the cementum, to the alveolar bone. So this periodontal ligament is completely torn. Second, the pulp is also damaged. Why? Because if the tooth has come out of the socket, the neurovascular bundle entering the pulp tissue at the apical foramen is completely severe. So the pulp and the periodontal ligament, these are the two important structures which are completely damaged when the tooth is avulsed. So the management of an avulsed tooth can be discussed under two broad categories: at the site of accident and in the clinic. But the most important thing to remember is immediate replantation is a treatment of choice in most of the cases. There will be certain contraindications. There is severe medical conditions like immunosuppression, and sometimes some cardiac conditions contraindicate replantation of a avulsed tooth. And also a primary tooth is never replanted. So that is the first thing which you have to ascertain, whether the tooth which has been avulsed is a primary tooth or a permanent tooth. So management at the site of accident. This is something which would be done mainly by the parent, teacher, or the caretaker. They might give an emergency call to the dentist or the pediatric dentist, and that pediatric dentist should be able to guide the parent, teacher, or the caretaker as to what has to be done with an avulsed tooth. So the instructions which are to be given to the parents are: ask the patient to be calm. You have to ask the parent to find the tooth, pick it with the crown, that is a wide portion of the tooth, to minimize contaminating and damaging the periodontal ligament. If the tooth is not clean, you ask them to gently clean it under tap water for just 10 seconds, not more than that. You only encourage them to replant the tooth, and if they are able to replant the tooth, once it is done, you ask the child to bite on a handkerchief to stabilize the tooth till the time they report to the dental clinic. If for some reason replantation is not possible immediately, which can happen in case a child has become unconscious because of a traumatic injury, or maybe the child is not cooperating. So in those scenarios, the tooth has to be carried in a suitable storage medium, and a suitable storage medium is something which should also be readily available to them. So the most common example would be milk, saliva, in that case the buccal vestibule in which the tooth can be kept. If the child is too young to carry the tooth in the buccal vestibule and might accidentally swallow, the child might be asked to spit saliva, and in that the tooth can be carried. What you have to tell them is they have to avoid storage in water, and after replantation they have to seek immediate dental care. They have to report to the dental clinic. So there are different storage media available for transport of an avulsed tooth. The best system is the saver tooth system, which is having Hank's balanced salt solution, that is HBSS, plus a pH balancing solution and a suspension apparatus. So the suspension apparatus is something which prevents further physical trauma to the tooth. Then you have Viaspan, you have Hank's balanced salt solution, HBSS, you have milk, saliva, saline. There are other storage media also, which culture and more. But the most commonly available is to a common layman is milk, in which they can easily carry an avulsed tooth. So we'll discuss what is HBSS and why it is a good storage media. So HBSS stands for Hank's Balanced Salt Solution. It has a pH of 7.2 and osmolality of 270 to 290 osmol per kg. And the composition is such that it not only maintains the ionic balance and osmolality, but it also provides nutrition in the form of glucose to the periodontal ligament cells. So the function of the storage media is to maintain the viability of the periodontal ligament cells till the tooth is replanted back. The next media is Viaspan, which is actually an organ transplant storage media. It is better than HBSS, has a pH of 7.4 and osmolarity of 320 OSM per kg. But the only disadvantage with this media, it is very costly and it is not at all readily available. Even though it is the best media, but not being readily available, it cannot be used.